I was discussing about the anatomy of the ear. We had finished the external ear anatomy. तुम्हारा ये क्या है? अच्छा, ठीक. So, so we had discussed about the external ear anatomy. Now coming on to the middle ear anatomy. So, middle ear is basically it is a cleft. It is called as the middle ear cleft, divided into three parts. What are those three parts? Middle ear cleft, it is called as middle ear cleft. It is divided into three parts. One is the tympanic cavity proper. That means what we know of as the middle ear proper. The second part is the Eustachian tube. So this is called as a middle ear cleft. Okay, this entire thing is called as a middle ear cleft. It comprises of three parts. One is this part. This is the middle ear proper. Second part is this. Second is the Eustachian tube, and third is the mastoid air cell system. Okay, so these are the three parts of the middle ear. Okay, and it is called as the middle ear cleft. If somebody asks you what is middle ear cleft, it comprises of these three parts. Okay. So coming on to the first part, that is the tympanic cavity or the middle ear proper. It consists of three subcompartments called as the epitympanum, mesotympanum, and hypotympanum. Upper, middle, and the lower part. The epitympanum or the attic lies above the level of the malleal folds. We had discussed the anatomy of the tympanic membrane also. There we had discussed about the malleal folds, separating pars tensa from the pars flaccida. Alright, so the part above those malleal folds comes under this epitympanic space. The mesotympanum lies opposite to the tympanic membrane proper, and the hypotympanic lies below the level of the inferior part of the tympanic sulcus. So this is the tympanic membrane. We are looking from outside. This is the area of the malleal folds. Above this is the epitympanic part. Just opposite to the membrane is the mesotympanum, and this small area below the tympanic annulus is the hypotympanic part. So walls of the tympanic cavity, it has 6 walls, is a box-like shape, and the walls are namely the membranous wall or the lateral wall called as the tympanic membrane, superiorly the tegmental wall, inferiorly jugular wall, carotid wall anteriorly, labyrinthine wall medially, and mastoid wall posteriorly. Go through this anatomy very, very carefully. You will be asked all the questions based on the anatomy itself. What is there in the middle ear? What all the structures are there in its wall? What things are present inside the middle ear? That is the contents of the middle ear. These are the basic questions. You should not make mistake. All right. So coming on to the lateral wall. The lateral wall of the tympanic cavity is found by the bony lateral wall of the epitympanum superiorly, the tympanic membrane centrally, and bony lateral wall of the hypotympanum inferiorly. This is the tympanic cavity. So this is the lateral wall, this is the medial wall, this is the superior wall, this is the inferior wall. तो lateral wall किस चीज से बन रहा है? Tympanic membrane proper, this bony part, this bony part. Understood? The lateral epitympanic wall is a wedge-shaped in section, and its sharp inferior portion is also called as the outer attic wall or scutum. This area, this wall is also called as scutum. Why? Because this wall shields this part. That is why it is a Latin name for this wall. It is called as scutum. It is thin and easily eroded by cholesteatoma, leaving a telltale sign on high resolution CT on coronal scan. So this is the coronal cut through the middle ear. and one of the ossicles. This is the handle of, this is the malleus, showing this is the malleal fold. Okay? This above part is the pars flaccida, this lower part is the pars tensa, this entire thing. Okay? This is the handle of malleus, this is the lateral process of malleus, this is the head of malleus, this is the neck of malleus. This upper part, malleus is adhered to the tegmen via the superior ligament of malleus. Just lateral to the neck of malleus is this nerve called as the cauda tympani nerve. It hugs the neck. All right. Furthermore, there is facial nerve canal. All right. So these are some of the parts showing in the coronal section. Unless and otherwise you go through the anatomy yourself, you will not understand anything. ठीक है, यहाँ बैठ के आप नहीं सीख पाओगे. It is expected कि आपको एक्सटर्नल एनाटॉमी में आपने पढ़ा होगा, चूँकि क्लास हो चुका है, एंड कुछ मिडिल एनाटॉमी भी पढ़ा होगा. If not, you will not understand anything. Understood? So, so there are 3 holes in the bone of the medial surface of the lateral wall of the tympanic cavity. The petrotympanic fissure is a 2 mm long area that receives the anterior malleolar ligament and transmits the anterior tympanic branch of maxillary artery to the tympanic cavity. The cauda tympani nerve enters through the, this should be posterior canaliculus called as the canal of Eustachian, and the anterior canaliculus at the junction of the lateral and the posterior wall. All right. So coming on to the roof. All right. So the roof is called as the Tegmen Tympani. The roof of the middle ear called as the Tegmen Tympani. It is a thin bony plate that separates the middle ear space from the middle cranial fossa. Above that root is part of the middle cranial fossa. It is formed by both the petrous and the squamous portion of the temporal bone. The petrosquamous suture line, which does not close until adult life, can provide a route of access for infection into the extradural space in children. So this is the applied anatomy. All right. That suture line is not closed during childhood, and it may provide a route for infection to the extradural space. Veins from the tympanic cavity running to the superior petrosal sinus pass through this suture line. Now, what is on the floor? The floor of the tympanic cavity separates the hypotympanum from the dome of the jugular bulb. ठीक है? ऊपर क्या है tympanic tegmen के ऊपर middle cranial fossa, brain. ठीक है? And floor के नीचे क्या है? Jugular bulb, jugular foramen के contents. ठीक? So what is the applied anatomy? Occasionally the floor is deficient and the jugular bulb is then covered by only fibrous tissue and a mucous membrane. It is highly vascular area. Suppose during a surgery this floor is dehiscent, you may injure the jugular bulb, and that can lead to lots of bleeding. So you need to be careful whether the floor is present or it is dehiscent, it is absent. Okay. At the junction of the floor and the medial wall of the cavity, there is a small opening that allows the entry of the tympanic branch of glossopharyngeal nerve into the middle ear. Now, the anterior wall, it is narrow as the medial and lateral wall converge. The lower third comprises of thin plate of bone covering the carotid artery. Okay, just visualize the lower third near the carotid artery, and the plate is perforated by superior inferior caroticotympanic nerves, the tympanic branch of internal carotid artery. All right. The middle third tympanic orifice of the Eustachian tube. Okay. So the lower part near the carotid artery, the middle part there is an opening for the Eustachian tube, and the superior part is usually pneumatized and may house anterior epitympanic sinus, a small niche anterior to the ossicular heads which can hide residual cholesteatoma in canal wall of surgeries. So this is the applied anatomy of the upper part, that is a hidden area, one of the hidden areas of the middle ear where the disease can be left behind. Okay, it is asked in the question in the exam or sometimes in short note also, what are the hidden areas of middle ear? What do you mean by that? Those areas which are difficult to access during surgery and you may leave the disease behind. One of those areas is this upper third of the anterior wall of this tympanic cavity. Now coming on to the medial wall. It separates the tympanic cavity from the inner ear. The promontory is a rounded elevation in the central portion of the medial wall. It covers the basal coil of cochlea and usually has small grooves on its surface containing the nerves which form the tympanic plexus. The promontory gently inclines forwards to merge with the anterior wall of the tympanic cavity. So what is promontory? Promontory is a bulge or elevation on the medial wall of the tympanic cavity. What does it signify? क्या है उसमें? So it covers the basal coil of cochlea. This is also asked. What is promontory? What is क्या है वो? Why the bulge? Behind and above the promontory is the oval window. Very important. Oval window's location is behind and above the promontory area. So the oval window is a kidney-shaped opening that connects the tympanic cavity with the vestibule, which is closed by the footplate of steps and its surrounding annular ligament. What is its size? 3.25 millimeters long and 1.75 millimeters wide. It is an MCQ question. Right? The oval window niche can be of varying width depending on the position of the facial nerve superiorly and prominence of the promontory inferiorly. So oval window का anatomical relation क्या है? Anteriorly होगा क्या? Bulge of the promontory and superiorly by the facial nerve canal. Okay, so जो oval window area है, that will be determined by their placement कि facial nerve कहाँ पर है और promontory का bulge कितना है. Okay, normally the size is this much. Now round window niche lies below and a little behind the oval window niche, from which it is separated by a posterior extension of the promontory called as the subiculum. देखो दो एंटिटी है यहाँ पे, subiculum and ponticulus. ठीक है, तो अगर आपको कभी मार्क करने आया, if you get something some question like label the parts, तो हमेशा याद रखना कि ponticulus will be above and subiculum will be below. Both are bony ledges that connect the promontory with the posterior wall. दो bony ledges हैं जो promontory से posterior wall में extend होते हैं. ऊपर वाला क्या है? ponticulus, नीचे वाला है subiculum. सिंपल, इसमें ज़्यादा दिमाग नहीं लगाना है. क्या है? दो बोनी लेजेस हैं जो कनेक्ट करते हैं प्रोमोन्ट्री एरिया को पोस्टीरियर वॉल के साथ. ऊपर वाला पॉन्टिकुलस है, नीचे वाला सुबिकुलम. अब इसका सिग्निफिकेंस क्या है? पॉन्टिकुलस और सुबिकुलम के बीच में पोस्टीरियर वॉल में जो है साइनस टिम्पेनाई होता है. दैट इज अगेन अ हिडन एरिया. देखो यहाँ पे लिखा हुआ है द लेटर टू मीट पोस्टीरियरली एंड लीड टू साइनस टिम्पेनाई. ठीक. So the round window membrane, also called as the secondary tympanic membrane. Okay. It is oval in shape, about 2.3 into 1.9 millimeters in size, and it lies at an angle, that is right angles to the plane of the stapes foot plate. Okay. It curves towards the scala tympani of the basal coil of cochlea and it's concave when viewed from the middle ear. Landmark, it is a landmark for the singular nerve. All right, ठीक है. Now, और भी क्या structures हैं medial wall में? The facial nerve canal, also called as the fallopian canal, runs above the promontory and the oval window in a anterior-posterior direction. Clear? सामने की तरफ से पीछे की तरफ anterior-posterior direction में run करता है fallopian canal on the medial wall. It has a smooth rounded lateral surface and often has microdehiscences. When the bone is thin and the nerve is exposed by disease, there are 2 to 3 straight blood vessels clearly visible along the line of the nerve. These are only straight blood vessels in the middle ear and indicate that facial nerve is very close by. This is very important. These are the only straight blood vessels in the middle ear and indicate that the facial nerve is very close by. ठीक है, अगर आपको straight ऐसे blood vessels दिख रहे हैं, that means those are the vessels over the facial nerve, because nowhere in the middle ear are these straight blood vessels. ठीक है, the facial nerve canal is marked anteriorly by processus cochleaformis, a curved projection of bone concave anteriorly which houses the tendon of tensor tympani muscle. Behind the oval window, the facial canal starts to turn inferiorly as it begins its descent in the posterior wall of the tympanic cavity. Suppose करो ये anterior wall है, ये posterior wall है, ठीक है, ये पूरा medial wall है. तो anterior wall में ये वाला portion जो है, that was the near the carotid artery, ये portion. जो medial 2/3 था, that was opposite to the Eustachian tube opening, and जो upper 1/3 था, that was the hidden area. ठीक, अब Eustachian tube opening के just posteriorly थोड़ा सा ऊपर की तरफ यहाँ पे एक projection होगा, that is called as the processus cochleaformis. वहाँ से facial nerve exit करके middle ear में enter करेगा, वहाँ से straight posteriorly जाएगा, इस area पे oval window होगा, ठीक, just above the oval window. Then it again turns down along the posterior wall. ठीक है, तो like this the facial nerve moves in the middle ear. ठीक, again you will have to go and study it, otherwise you will not understand. सब Greek and Latin लगेगा कि क्या बोल रहे हैं ये. ठीक है, anatomy is something you need to visualize it to understand it. It cannot be taught on text. ठीक है, नर्व किसके ऊपर नीचे जा रहा है तुमको विजुअलाइज करना होगा ना. मैं तो यहाँ पे लिखा तो रहेगा लेकिन समझ में नहीं आएगा वो. ठीक, now the posterior wall, one of the most important walls. The upper part has a large irregular opening called as the adytus ad antrum. It is the gateway to the mastoid air cell system. Okay, fossa infundus, it is just below this opening, just below the adytus is a small depression, and this fossa infundus is क्या मतलब इसका speciality क्या है? It houses the short process of incus and its suspensory ligament. Pyramid, a small hollow conical projection with its apex pointing anteriorly, houses the stapedius muscle and tendon. ठीक है, so facial recess, ये term very important है. Facial recess is a groove that lies between the pyramid with facial nerve and annulus of the tympanic membrane. So facial recess का boundary क्या है? Medially by the facial nerve, laterally by the tympanic annulus, with chorda tympani running obliquely through the wall between the two. ठीक है, इसका importance क्या है? Of the posterior wall, ये वाला जो है ये 7th nerve है, correct? ये जो eminence है, this is the pyramid. Okay, so pyramid और 7th nerve के बीच में ये जो एरिया है, यहाँ से आपका chorda tympani nerve move करता है. ठीक है, तो in between these two nerves is the area called as the facial recess. So what is the अप्लाइड एनाटमी कि अगर आप इस मिडिल ईयर में एंटर करना चाहते हो विदाउट डिस्टर्बिंग द टिम्पैनिक मेम्ब्रेन, तो आप इस एरिया को अगर ड्रिल करोगे इन बिटवीन द टू नर्व्स, देन वी कैन एंटर इनसाइड द मिडिल ईयर. And this is exploited in while doing the cochlear implant surgery, in which we do not open the middle ear, we enter the middle ear via the facial recess. Okay. Angle between the facial nerve and chorda tympani allows posterior tympanotomy, means we are making an opening posteriorly, allowing access to the middle ear from the mastoid without disrupting the tympanic membrane. Clear? Facial recess will be asked 100%. उसका एनाटमी क्या है और उसका इम्पोर्टेंस क्या है. तो फेशियल रिसेस हो गया ये इन बिटवीन टू नर्व्स, सेवंथ नर्व एंड द कॉर्डा टिम्पेनी नर्व. सेवंथ नर्व के और बिलो जो है ये वाला जो हिडन एरिया था, दिस एरिया, दिस इज कॉल्ड एज द साइनस टिम्पेनी. देखो कैसा है ये छुपा हुआ है. अगर आप इधर से देख रहे हो ये दिखेगा आपको? नहीं दिखेगा. दैट इज वाई डिजीज, रेसिडुअल डिजीज इज लेफ्ट हेयर, दिस पार्ट. ठीक है. अच्छा, ये है ड्यूरिंग द सर्जरी. दिस इज द सेवेंथ नर्व, दिस इज द लेटरल सेमिसर्कुलर कैनाल एंड दिस इज द कॉर्डा टिम्पेनी नर्व, सीटी. तो हमने इन दोनों के कॉर्डा एंड सेवन, ये है तुम्हारा हेड एंड है, ये टो एंड है, मतलब ये लेफ्ट ईयर का है. तो ये नर्व उधर से आके ऐसे जा रही है नीचे. ठीक है. तो यहाँ से कॉर्डा टिम्पेनी इज अ ब्रांच ऑफ द फेशियल ओनली, तो वहाँ से आया फेशियल. ये है दोनों के बीच का जो ये बोनी पार्ट है इसको हमने हटा दिया. दिस इज कॉल्ड एज द फेशियल रिसेस. अब ये हटाने के बाद जो ये ओपनिंग हुआ, दिस इज कॉल्ड एज द पोस्टीरियर टिम्पेनोटमी हमने किया. वहाँ से हमें क्या दिख रहा है? ये दिख रहा है हमें स्टेपीज का सुप्रास्ट्रक्चर और इनक्यूडोस्टेपिडियल जॉइंट, और ये इनकस है. ठीक है. मतलब हमें मिडिल ईयर दिख रहा है. यहाँ से हम जो है वी कैन डू द इम्प्लांटेशन ऑफ द कॉक्लियर इम्प्लांट. ठीक है. सो वी नीड नॉट ओपन द मिडिल ईयर वाया द टिम्पैनिक मेम्ब्रेन. ठीक है. Now coming on to sinus tympani, it is located at the junction of the lateral and the posterior walls of the tympanic cavity. It lies between the ponticulus superiorly and subiculum. ठीक, जैसे बताया था. Bounded by pyramidal ridges externally and promontory internally. इसका significance क्या है sinus tympani का? Residual disease. ठीक. Facial recess का मिडिल ईयर एंट्री विदाउट डिस्टर्बिंग द टिम्पैनिक मेम्ब्रेन. ठीक. ये दो चीज़ है पोस्टीरियर वॉल में वेरी इंपॉर्टेंट. ठीक. सो पोस्टीरियर एक्सटेंशन ऑफ द मेसो टिम्पैनी. अच्छा, व्हाट इज साइनस टिम्पैनी? ओके, इट इज द पोस्टीरियर एक्सटेंशन ऑफ द मेसो टिम्पैनम डीप टू बोथ promontory and facial nerve. The sinus can extend as far as the mastoid bone. The medial wall continuous with the posterior portion of the medial wall of the tympanic cavity, where it is related to the oval and round window niches and subiculum of the promontory. Most inaccessible site, middle ear का most inaccessible site is sinus tympani. Okay. Again a MCQ question. This is a very important slide. The contents of tympanic cavity, the contents of the middle ear. क्या क्या है? ossicles are there, two muscles are there, the chorda tympani nerve is there and the tympanic plexus is there. ठीक. so ossicles में क्या क्या है? malleus incus stapes. and muscles जो हैं दो क्या हैं? the muscles are tensor tympani muscle and stapedius muscle. there is difference between walls and contents. इस लेक्चर रूम के हम लोग कंटेंट्स हैं, बट ये सारी चीज़ें जो लगी हुई हैं ये सब इसके वॉल्स के पार्ट्स हैं. समझ में आया बात डिफरेंस? वॉल्स जब पूछा जाए तो वॉल का एनाटॉमी बोलना है. कंटेंट जब पूछा जाए तो ये कंटेंट्स ऐसे इन्यूमरेट करने हैं. ठीक है. दिस इज अ वेरी इंपॉर्टेंट क्वेश्चन. व्हाट आर द कंटेंट्स ऑफ टिम्पैनिक कैविटी? So this is the ossicular chain. This is the malleus, incus and stapes. This is how they are arranged. So the malleus, also called as the hammer, 9 millimeter in length, comprises of head, neck and handle, or the manubrium. The head lies in the epitympanic part. The head of the malleus articulate with the body of the incus via a synovial joint. Again, MCQ question: what type of joint is that? It is a synovial joint. Okay. Below the neck, the lateral process, the anterior process, these are not important that much. The lateral process, it is a prominent landmark on the tympanic membrane and receives the anterior posterior malleal folds from the tympanic annulus. So, ये है, this is the head, this is the neck, this is the manubrium. ये जो है, this is the lateral process. Okay, and ये जो joint है, that is the synovial joint. Okay. Whenever you study, जैसे ये important है malleus के बारे में, ठीक है, तो इसको पढ़ना कैसे है? हाउ विल यू रिमेंबर इट? पढ़ के तो याद नहीं होगा, कितने बार पढ़ोगे इसको? तो ये जो इमेज है ना आपका, ये इमेज, इसी के सामने आपने लिख लिया कि ये 9 मिलीमीटर्स का है, यहाँ पे एरो बना लिया, ये साइनोवियल जॉइंट है, ठीक है। तो इस तरीके से पिक्चर मेमोरी डेवलप किया जाता है। तो मेक इट अ हैबिट। सब कुछ टेक्स्ट में रखने से यू विल नॉट रिमेंबर द थिंग्स, पिक्चर्स यू टेंड टू रिमेंबर मोर, ठीक है। The chorda tympani crosses the upper part of the malleus handle on its medial surface above the insertion of tendon of tensor tympani, but below the neck of the malleus itself. मतलब इस एरिया से chorda tympani पास करता है, यहाँ वाले एरिया से, ठीक है। chorda tympani is what? It is a nerve, जो बताया। Now coming on to incus, articulates with the malleus, has body and true processes. The body lies in the epitympanum, suspended by the superior incudal ligament. The short process lies in the fossa incudis. अभी जो बताया, facial recess के ऊपर वाला एरिया, जहाँ पे जिसको कहते हैं हम लोग fossa incudis. मतलब incus का पार्ट है, इसलिए fossa incudis simple, ठीक। The long process descends into the mesotympanum and at its tip is a lenticular process, also called as the fourth ossicle. Very important. चौथा ऑसिकल, ये जो है ना, ये लॉन्ग प्रोसेस, इसके एंड पे ये जो छोटा सा प्रोसेस है, कॉल्ड एज अ लेंटिकुलर प्रोसेस, इसको भी हम लोग कभी कभी फोर्थ ऑसिकल भी कहा जाता है। नाउ द स्टेप्स, ऑल्सो कॉल्ड एज स्टिरअप, शेप्ड लाइक अ स्टिरअप। स्टिरअप मतलब कंसिस्ट ऑफ हेड, नेक, एंटीरियर पोस्टीरियर क्रूरा एंड अ फुट प्लेट। The head has a synovial articulation with the lenticular process of incus. The stapedius tendon insert into the neck and upper portion of the posterior crus. The two crura arise from the lower part of the neck. Foot plate is 3 mm long and 1.4 mm wide over the oval window. All right, and it is surrounded by this annular ligament. Okay. Now the stapedius muscle. It arises from the wall of a conical cavity within the pyramid, attaches to the neck of the steps, helps to dampen the loud sound, preventing noise trauma, supplied by branch of facial nerve. So both the muscles in the middle ear, what are their function? Why they are present? Second muscle arises from bony canal above the Eustachian tube, the cartilaginous part of the Eustachian tube and greater wing of sphenoid, attaches to the neck of the malleus, tenses the tympanic membrane, supplies by branch of mandibular nerve. एक muscle by facial nerve, एक muscle by mandibular nerve. It helps to dampen loud noises. ठीक है? Stapedius muscle dampens the loud noise by tensioning the stap suprastructure. जब वाइब्रेशन हिट करेगा टिम्पैनिक मेम्ब्रेन को तो ऑसिकुलर चेन के थ्रू जाएगा ओवल विंडो में। अगर ऑसिकल को किसी ने जोर से पकड़ रखा है तो उतना लाउड नॉइज जा पाएगा, तो इसीलिए स्टेपिस हेड को पकड़ता है ये स्टेपिडियस मसल। ओके। दूसरा, अगर हम किसी तरीके से टिम्पैनिक मेम्ब्रेन को टेंस कर दें तो वो भी कुछ साउंड एनर्जी को रिफ्लेक्ट कर देगा। तो दैट इज वेयर दिस टेंसर टिम्पेनाई, क्या नाम है इसका, टेंसर टिम्पेनाई, इट टेंसेस द टिम्पैनिक मेम्ब्रेन, ठीक है। सो दीज टू मसल्स आर देयर फॉर प्रोटेक्शन फ्रॉम लाउड साउंड, ठीक है। एंड दिस इज वेरी इंपॉर्टेंट, नर्व सप्लाई, लाइक इन एनी मसल केस कि नर्व सप्लाई क्या है। टेंसर टिम्पेनाई का क्या है, मैंडिबुलर ब्रांच, एंड स्टेपिडियस का क्या है, फेशियल नर्व। सो वन ऑफ द नर्व्स, द कॉर्डा टिम्पेनाई नर्व, इसका क्या इंपॉर्टेंस है कॉर्डा टिम्पेनाई का, सुन, टंग पे, वेरी गुड। क्या होता है टंग का, बहुत अच्छे, क्या होता है टंग का, फर्स्ट ईयर एनाटॉमी है। टंग का क्या है, मतलब टंग का सेंसरी सप्लाई है, मोटर सप्लाई है, स्पेशल सेंसरी और टेस्ट सप्लाई है, क्या है टंग का मोटर सप्लाई, क्या होता है। It enters the tympanic cavity from the posterior canaliculus on the posterior wall at the junction of the lateral and the posterior walls, okay, and it runs across the medial surface of the tympanic membrane between the mucosal and fibrous layer, then passes medial to the upper portion of the handle of malleus above the tendon of tensor tympani, like already discussed, continues forwards and leaves by the way of anterior canaliculus, which subsequently joins the pituotympanic fissure. मतलब कॉर्डा टिम्पेनाई नर्व traverses the tympanic cavity from the posterior to the anterior part along this tympanic membrane, ठीक है, just medial to the this neck of the malleus, ठीक है। One of the contents again, tympanic plexus, it is a plexus of nerves formed by tympanic branch of glossopharyngeal nerve called as a Jacobson's nerve. Keraticotympanic nerves arise from the sympathetic plexus around the internal carotid artery. Whatever I am asking here and you are not able to answer, just make it a point to go and find those answers. ठीक है, टंग का नर्व सप्लाई इज बेसिक थिंग, नथिंग फैंसी अबाउट इट। सेंस ऑर्गन का अगर नर्व सप्लाई आपको नहीं पता है तो व्हाट, क्या बन रहे हो तुम लोग, है ना। उसको जाके देखना आज क्या होता है टंग का नर्व सप्लाई। इफ यू गो एंड रीड इट यू विल रिमेंबर इट, इफ आई टेल यू विल नॉट रिमेंबर इट, दैट इज द डिफरेंस, ठीक। द नर्व्स फॉर्म अ प्लेक्सस ऑन द promontory, branches the mucous membrane lining the tympanic cavity, Eustachian tube and Mastoid air cell system. Branches to join the greater superficial petrosal nerve and lesser superficial petrosal nerve. All right. The mucosa of the tympanic cavity, mucus secreting respiratory mucosa bearing cilia. Three distinct mucociliary pathways can be identified: epitympanic, promontorial, and hypotympanic. Each of these pathways coalesce at the tympanic orifice of the Eustachian tube. All right. The mucous membrane lines the bony walls of the tympanic cavity and extends to cover the ossicles and the supporting ligaments. मतलब ये mucosa जो है middle ear का, it covers everything, all the walls, all the ossicles, all the everything, okay. It also covers the tendons of the two middle ear muscles and carry their blood supply. These folds separate the middle ear space into compartments. Suppose करो एक mucosal lining है covering everything inside the middle ear, ठीक है, it is covering every structure inside the middle ear. तो वो कैसा दिखेगा, it will look like compartments, है ना, हर चीज को कवर कर रहा है तो कैसा लगेगा देखने में, ठीक है। तो मिडिल ईयर के अंदर कंपार्टमेंटलाइजेशन हो जाता है। व्हाई इट इज इंपॉर्टेंट, बिकॉज ऑफ दिस, ईच ऑफ दिस, ओके, द म्यूकस में लाइंस द बोनी वाला टिम्पानी के एंड एक्सटेंड द ऑस्कुलर, हो गया, ठीक है। The folds separate the middle ear space into compartments. All right. The only route for ventilation of the epitympanic space from the mesotympanum is via two small openings between various mucosal fold, the anterior and posterior isthmus tympani. It is very important. Middle ear properly work कब करेगा? जब वहाँ पे air है coming via the eustachian tube. ठीक. अब ये जो कंपार्टमेंट्स हो रहे हैं, इन कंपार्टमेंट्स के थ्रू जो ओपनिंग्स हैं उसके थ्रू एपिटिम्पैनिक स्पेस में एयर जाएगा, वहाँ से मैस्टॉइड एयर सेल सिस्टम में स्पेस एयर जाएगा. ठीक है. तो जो एपिटिम्पैनिक स्पेस में जो एयर जाता है दैट गोज वाया दिस टू फोल्ड्स, मतलब दिस टू स्मॉल ओपनिंग्स. किसी वजह से अगर ये ओपनिंग्स बंद हो जाती हैं, ठीक है, दैट विल रिजल्ट इन नॉन एरेशन ऑफ द एपिटिम्पैनिक पार्ट. फिर वहाँ पे the disease will occur. ठीक है. So another entity is Prusac space between the pars flaccida and the neck of the malleus, and it is bounded by the lateral malleal folds. This space can play an important role in retention of keratin and subsequent development of cholesteatoma. Prusac space के ऊपर short note भी आता है. Okay. Mucosal folds, ये this is PG level thing, you need not know it, but just have an idea. The mucosa in the middle ear engulfs all the structure leading to compartmentalization of the middle ear. उसमें दो important opening है जिसको isthmus, anterior posterior isthmus बोला जाता है. Those are the areas through which the epitympanic space get its aeration. अगर किसी वजह से ये दोनों openings block हो जाती हैं तो एपिटिम्पैनिक स्पेस में एरेशन रुक जाएगा, जिससे वजह से डिजीज प्रोसेस कैन अकर. ठीक. दीज आर ऑल द नेम्स ऑफ द म्यूकोजल फोल्ड्स, नॉट इम्पॉर्टेंट इन योर केस. देखो ऐसा लगता है कवर्ड, सब कुछ कवर किया हुआ है म्यूकोजा से. ये जो स्पेस है, ठीक है, यहाँ से एयर अगर आता है तो इस स्पेस के थ्रू ऊपर जाएगा. अगर ये स्पेस ब्लॉक हो जाएगा तो क्या होगा? ऊपर एयर नहीं जाएगा, तो ऊपर वाले एरिया में फिर डिजीज प्रोसेस स्टार्ट हो सकता है. सो ब्लड सप्लाई ऑफ टिम्पैनिक कैविटी arises from both the internal and external carotid system. These are names, just you can work it up. क्या क्या है? anterior tympanic, stylomastoid, maxillary, posterior auricular, middle laryngeal and anterior pharyngeal artery, all this part. Venous drainage is via pterygoid plexus and to the superior petrosal sinus, lymphatic to the retropharyngeal and parotid lymph nodes. So eustachian tube, ठीक है. तीन चीजें थी ना अभी तक हम लोग. मिडिल ईयर प्रॉपर किया, eustachian ट्यूब है, मैस्टॉइड एयर सेल सिस्टम है. eustachian ट्यूब it links the middle ear with the nasopharynx. Length is 36 millimeter and it is reached by age of 7. Runs downwards from the middle ear at an angle of 45 degree and it is turned forwards and medially. Okay. The lateral third is bony, arises from the anterior wall of the tympanic cavity. Medial 2/3 is cartilaginous. It is the narrowest portion called as the isthmus, where the diameter is only 0.5 millimeter or less. ठीक है. Lateral 1/3 is bony, medial 2/3 is cartilaginous. Just opposite of the क्या? External auditory canal. It is lined by respiratory mucosa containing goblet cells and mucous glands having ciliated epithelium on its floor. A thin plate of bone forms the roof, separating the tube from the tensor tympani muscle above. The carotid canal lies medially and can impinge on the bony eustachian tube. In the nasopharynx, the tube opens 1 to 1.25 centimeters behind and below the posterior end of the inferior tabinate. This is a MCQ question. कहाँ पे खुलता है ये? ठीक, nasopharynx पे. The opening is triangular in shape and is surrounded above and behind by the torus. What is torus? Go and study today. क्या है torus? ठीक है, torus tubaris. The salpingopharyngeal fold stretches from the lower part of the torus downwards to the wall of the pharynx. The levator palati, as it enters the soft palate, results in small swelling immediately below the opening of the tube. Behind the torus is in the pharyngeal recess, or called as the fossa of Rosenmuller. तो fossa of Rosenmuller का क्या clinical importance है? Go and find out. ठीक? Lymphoid tissue is present around the tubal orifice and in the fossa of Rosenmuller and may be prominent in childhood. So muscles attached to the Eustachian tube. ठीक है? Tensor veli palati arises from a bony wall in the upper portion of the front wall of the cartilaginous tube. The muscle converges, not important. It is supplied by mandibular nerve. ठीक है? अच्छा, टेंसर टिम्पेनाई, टेंसर वैली पैलेटिनी जो होता है, ये क्या होता है? This is the muscle which opens the tube. ठीक है? Eustachian tube को जो open करता है, this muscle. ठीक है? And एक होता है this levator valley palatini. This is the muscle which predominantly closes the tube. ठीक है? So three muscles are there: tensor palati, salpingopharyngeus, and levator palati. Blood supplies ascending pharyngeal and middle meningeal arteries supply the Eustachian tube. Veins are it drains into the pharyngeal plexus. Lymphatic is to the retropharyngeal node, and nerve supply is by the pharyngeal branch of sphenopalatine ganglia for the from the ostia, and the nervous spinous for the cartilaginous portion of the tympanic plexus for the bony part. Okay. So we'll be discussing the mastoid air cell system in the next class. I think. कितना time बचा? 5 minutes are there. चलो जल्दी से कर लेते हैं. Mastoid air cell system. ठीक है. Third part. You need not remember all the names of all the cells. Mastoid air cell system. बहुत सारे air cells हैं. कुछ air cells के नाम अगर आप बोल पाए, that is more than enough. There are 5 recognized regions of pneumotization: the middle ear, mastoid, prelabyrinthine, petrous apex, and accessory. Middle ear में क्या है? Epitympanic, hypotympanic, mesotympanic, protympanic, and posterior-tympanic area. Mastoid region में क्या है? Mastoid antrum, central mastoid, and the peripheral mastoid. ठीक है? Perilabyrinthine में है supralabyrinthine, infralabyrinthine. Petrous apex में है apical area and peritubal area. Accessory regions में है zygomatic, squamous, occipital, and styloid areas. These are PG level things, not important. This is important. The mastoid antrum, it is an air-filled sinus in the petrous part of the temporal bone. It communicates with the middle ear by the adytus. ठीक है? Volume is 2 milliliters in adults, and it is well developed at birth. Mastoid antrum is well developed at birth. The medial wall relates to the posterior semicircular canal. More deeply and inferiorly is the dura of the posterior cranial fossa and the endolymphatic sac. Mastoid antrum के relation में this line is important. The roof of the mastoid antrum and the mastoid air cell space forms the floor of the middle cranial fossa. Just continuation of the Tegmen Tympani posteriorly. Okay? Tegmen was what? Tympanic cavity का जो roof है, उसके continuation. इसको कहते हैं Tegmen mastoidium. वो Tegmen Tympani है. ठीक है? So sigmoid sinus, it forms the posterior limit of the mastoid cavity, passes deep part of the mastoid process under the facial nerve towards the jugular foramen. Sinodural angle क्या होता है? Angle between the middle cranial fossa and posterior fossa dura plate and superior part of the sigmoid sinus. ठीक है? Nothing important. This is important. What is McEwen's triangle? It is the surface landmark for mastoid antrum. एग्जाम में ये आपसे पूछा जाएगा. ठीक है? कहाँ पे होता है? टेम्पोरल लाइन, सुपीरियर टेम्पोरल लाइन हुआ. ठीक? posterior superior segment of the bony extraordinary canal, like this, all right, and a tangent through the posterior border of the extraordinary canal, this tangent. So this area, this, so this area is the area where we drill the bone out to reach the mastoid antrum. Okay. Normally lining of the mastoid is flattened and non-ciliated epithelium without goblet and mucous cells. So around 1.5 to 2.5 centimeter deep to this area will lie this mastoid antrum. What is the beauty of mastoid antrum? It is the largest mastoid air cell. Okay? And it will be present even if rest of the air cells have been sclerosed. ठीक है, उसका वॉल्यूम कितना होता है 2 ml. And the anatomy of Machiavellian's triangle is very important. ठीक, okay, thank you. So इसके बाद जो बचा है anatomy of the inner ear.